Well, prior to being diagnosed with cancer, my career has been largely in education. At the time that I got diagnosed, I was unemployed. It was kind of a strange route. I had some issues in late October of 2016, and then went to see my general physician. She said, "You're 48, let's get a colonoscopy done, because it seems like that's not something that should be happening. Could be liver function, could be whatever. Let's start diagnosing." So I went ahead and went down to Franciscan Health and had my colonoscopy done. Small chance of cancer, and of course I'm now, I call myself the 1% guy, because apparently I beat all the odds for that. I haven't had the lottery, but I still have the cancer. So I went ahead and went down to Franciscan Health, met with Dr. Raghavendra. We started to, after surgery and after 6 weeks of post-op. So we started with chemotherapy, tried to figure out, did a PET scan, figure out where the cancer was. So I have MDAC, which apparently is the ninja of cancers. It likes to hide. So my cancer doesn't go away. I'll never be rid of it. So I came to grips with the fact that I'm gonna have chemotherapy for the rest of my life. And that's where a lot of the Franciscan Foundation came in, because they were able to help me with mental health care. They were able to help me financially with food or with gas, so that I could make these trips and continue on. I think Franciscan Health has been phenomenal. And I'm not talking about just the level of care, but there's a community of compassion, I think that's how I'll term it, that pervades everyone I've seen, from every volunteer, every staff member, pastoral staff, surgical staff, nursing staff, doctors. Everyone that I've encountered through Franciscan Health has been on my side. I think that they can see through us, through the patients and our reactions, that it's very effective. This is how you should treat people. This is how you should approach these kind of situations where you're telling someone, sorry. When you sit down and you tell someone, sorry, not necessarily in direct terms, but you tell them you're gonna die. A personal, one-on-one, this is it, and you're not changing it. And I think that what Franciscan Health does is that they have respect for the dignity of that person. So when we deliver the news, when we talk about the situation, when things go sour, I just learned Wednesday of this week, 2 days ago, that my cancer had come back. I have to make an adjustment to the chemotherapy. It's in a different location. It's in a bone now, which causes some concern, raised concern. But I think that when they sit down and they have those conversations with you, it's someone who cares about you. And I think that dynamic that Franciscan Health brings to the situation is so critical. And I think that part and that support is what helps to keep me going. I would say, not to put too fine a point on it, but I think you should donate to the Patient Assistance Fund, because $5 saves somebody's life. And I think it's as simple as that. We give blood, we donate time, we volunteer. But if you can give up one shot of Starbucks, then you're gonna help somebody like me to survive through and overcome. That is the essence of that compassion, and that support is the essence of what it takes to fight this condition and defeat it.